Just days after the FDA approved the use of vaccines in children between the ages of 5 and 11. Now, the dosage for children in that age range is about a third of the adult dosage and is only approved for kids who are at least 5 years old. Our Megan Rivers is here to verify why the vaccine is approved for age ranges and not by a child's weight. Hey, Megan.
Hey, Lorenzo, since the approval came down for kids as young as 5 to receive the vaccine, a lot of parents have asked if their child is a certain weight, can they get the vaccine? So we verified. Our sources for this story are the FDA and Dr. Allison Agu from Johns Hopkins Children's Center. The FDA authorized the emergency use of the Pfizer vaccine for children ages 5 to 11 earlier this week. The vaccine was found to be 90% effective in children that age range. So why is the COVID-19 vaccine approved by a child's age and not their weight?
This concept of being based by age range is not actually unusual, right? And so when they studied, what you want is the dose that will get the response that will, in this case, neutralize or be able to protect. And this dose happened to work for this age range.
Which brought on the question, what could potentially happen if you take a dose not approved for your age range?
In some cases, if you give somebody a dose that's too high, you may have a more robust response than you need to, and that could be more likely for side effects.
Parents across the metro region have already started vaccinating their children. Lindsay Oles says her 5-year-old son Finn got his first dose this week.
You know, we just believe in the herd immunity. Like we're just doing our part, and you know, he's around kids all the time and we want to be able to go out and enjoy our life.
So we can verify children should only get vaccinated if they are at least 5 years old. Now, we also asked the doctor about the distribution of the vaccine, and she says there is a great demand for the vaccine for children. And while that's not her area of expertise, she doesn't think we'll see as many hurdles with the availability as we did with the initial rollout of the adult vaccine. In the studio, Megan Rivers, WUSA 9.
All right, Megan, thank you. And parents will soon have even more choices on where to get a vaccine for kids between the ages of 5 and 11. Our sources for this information are press releases and statements from 2 major pharmacy chains. Walgreens is going to start offering the vaccines for children as young as 5 tomorrow, Saturday, November 6th. CVS will start the pediatric shots on Sunday, November 7th. Well, England is the first country to approve an antiviral pill to treat COVID-19. It's for people with mild to moderate symptoms and have at least one risk factor like obesity or heart disease. Now, studies show the pill manufactured by Merck cuts the risk of hospitalization or death in half.
To have a drug like this, to have an antiviral that's potent, that's able to be taken orally, is a very important moment and does mark a milestone.
All right, so get this. Studies found the pill is most effective when taken within the first 5 days after those COVID symptoms appear. Now, if it gains FDA approval, the drug could be available here in the U.S. as early as next month.